with our next presentation, and our next presenter will be Dr. Hema Divakar. And Hema is the medical director at the Divakar's Specialty Hospital in Bangalore, a center of excellence for women's healthcare and the Center for Skill Enhancement. Dr. Divakar is currently the vice chair of the NCD committee at FIGO. She is the national coordinator for FIGO Foxy WDF program and the national coordinator for Foxy Quality Initiatives. She is also a previous recipient of the FIGO Women's Achievers Award and has a Lifetime Achievement Award from the Diabetes in India study group. She is a senior co-author of the Hyperglycaemia in Pregnancy Guidelines. Hema ji, please.
Thank you, Mujhe. Namaskar. Greetings from India. I am supposed to be speaking on connecting the postpartum care with pregnancy complications with respect to hyperglycemia. I've put a small icon of acknowledgement here because we from the low and middle income countries are in an attitude of gratitude to FIGO, which truly represents the global voice for women's health, because the global consensus on hyperglycemia in pregnancy brought us to the global implementation of the recommendations, simmering down the controversies, and it is of huge relevance to the South Asian countries in achieving the objectives of FIGO GDM or hyperglycemia in pregnancy initiatives. EL just showed you the window. So ladies and gentlemen, keep your mind and windows open to what can happen soon after and well beyond the pregnancies, both to the mother and the offspring. We in South Asia need these recommendations and the thought processes to be firm in our minds, because we are the contributors of 19% of the global burden. You can see here that SEA or Southeast Asian countries rank the highest in terms of prevalence of hyperglycemia in pregnancy as per the IDF regional atlas, which was published in the year 2019, a huge whopping 25%. And it does not end with the birth of a healthy baby. The long-term implications of gestational diabetes for the mother, putting her to a lifetime risk of type 2 diabetes, which may be 20 times higher than in other women. And 50% of these, if not full-blown diabetics, will develop impaired glucose tolerance and the metabolic disorders within 10 years of having gestational diabetes. It doesn't end there either. Children born out of these are prone to childhood obesity and early onset adulthood diabetes. There are more than one reasons why you need to connect postpartum care, the long-term postpartum care, to this entire segment where pregnancy is offering you that window of opportunity, which identifies the women and the babies at increased long-term risk of obesity, type 2 diabetes, and cardiovascular diseases. Oftentimes we complain that the target group of adolescents or the menopausal women don't reach us, but we certainly do have the target of the pregnant women coming to our doorstep. Please do your best during the pregnancy and delivery, but also remember to continue to follow them up forever and forever. Diabetes status in India, we have 80 million diabetics in the country. Half of them are women, which means 40 million women in the country with diabetes type 2. Half of them, that is more than 20 million, have emerged out of the pregnancy that they may have had in the recent past. And Anil and health economics, you just see the second bar, the India spends on the health expenditure for this segment, which is so minuscule compared to the towering problems that we have. So the background is majority of our women are neither tested for diabetes during pregnancy and are managed suboptimally during the antenatal and postpartum phases. So we are clearly missing the bus there. The hyperglycemia in pregnancy represents a very serious public health problem in countries like India, and more than 30 million births with 3 to 4 million complicated by hyperglycemia, very few of them detected and treated and only a minority, a minuscule percentage receiving the postpartum follow-up and the lifestyle advice. Undiagnosed diabetes, you will again see as many millions are diagnosed, that many millions of undiagnosed are also in our population just because they're never ever tested. And the health expenditure is ever on the rise in already the struggle that they have with their family economies. The malady kickstarts, as we have been bringing home again and again, that it all starts in utero, whether it be a low birth weight baby or the one with is large for gestational age with hyperglycemia in pregnancy. Both of these will place the adult at elevated risk for obesity, cardiovascular diseases, and diabetes. And this intergenerational transfer, you will see on the picture here, that in every possible mode, even through performing arts, we have tried to convey to our communities that this is indeed very, very important for them to take care. So the best time to invest, dear friends, is the care of the mother and the infant. And we have to keep track of the offsprings in their childhood and adolescent, track them, and also these women who have delivered year after year, forever in their lives through their adulthood. If we do this with this kind of intervention, we are very, very likely to contain the tsunami of NCDs, as we call it. Without any intervention, you see the topmost bar there, which is scaling really, really high up and reaching uncontrollable proportions. Yes, in our countries, we do have societal problems. The gender bias, the SDG goal of gender equity is also prime in our minds. There are societal and individual barriers. There's negligence of women's health, low awareness, stigmatization. Any and all kinds of excuses are made for not offering the right kind of care with inadequate resources and poor services. But then the initiative has to begin, first of all, by sensitizing the healthcare providers. It's no good asking people to do what they can't do, or they don't have the equipment, or they don't have the knowledge to do. So this is a very serious exercise for all of us to disseminate amidst our own peer group, that everything does not end with a take-home healthy baby and a healthy mom, but a long-term care is really important. And the diagnosis, the quality of care, pregnancy outcome, and long-term prevention has ever to be kept in mind. So this is a call to action. Push for the caregivers and the women to be made aware of the risks and opportunities to modulate the long-term risks. Strive for all women with risk factors such as obesity, hypertension, hyperglycemia to be offered post-pregnancy counseling. Educate the women and discuss with them, reflect on their obstetric histories, which may be having far-reaching complications. Reporting of gestational diabetes in maternity data system should be made compulsory so that we have some more of tracking these women. And one of the most important ideas that we have mooted with everybody around, inclusive of our government, is to integrate the services, the record keeping and tracking mechanisms, linking the postpartum follow-up with a well baby or vaccination programs. So somewhere along the journey in their life, we get to see them, detect early, and advise them about the lifestyle. So in middle income countries, LMIC as we call it, yesterday we were grappling with obstetric emergencies and saving lives. Today we are doing an advocacy about non-communicable diseases. And if we don't act upon it, we will be faced with a tsunami or epidemic of diabetes and obesity. And tomorrow we will land up tackling the cardiovascular diseases, hypertensive disorders, obesity, etc. So my key messages are that affluent countries have set up a national diabetes prevention program. We should not lag far behind in our countries too. Something which is cost effective, something which gives us an opportunity for prevention like the postpartum check and a comprehensive assessment of the HbA1c, the cardiovascular assessment, the blood pressure, smoking history, lipid management, etc., which can put the patient into a green, amber, or the red zone and can be tackled thereafter. Everybody, just about everybody has a role to play in this. It is not the physician's problem or somebody else who is expected to take care. The responsibility lies on the shoulders of each one of us. So let's strive to make a difference. in right earnest, the FIGO Foxy initiative with the World Diabetic Foundation has made a huge impact of the capacity building for gestational diabetes detection and management. At the moment, we are struggling to link this for a long-term NCD care. And with all of you who are attending the webinar today, I'm sure that you're sensitized enough to remember and recall that enough is not enough, and the last word is not yet said until we track these women and these children in entire life's goals. These are some of the references which have been used for the presentation today. Thank you very much.
Thank you, Hema ji. Perfect. Stay alive. We'll come back to the Q&A later. The next two questions will go to Hema. One comes from Vivian De Leon. Why diabetes screening need during the postpartum? Is it essential during the antenatal care? And what is the method of glucose tolerance test ideally? Hema, please summarize our guidelines.
Yes, so that's why I said we gratefully acknowledge, because there's no ideal test. What is doable and feasible in different settings is different. FIGO has recognized that. And therefore, in the Western world, where the gold standard test, what it's called a two-step test or a complete OGTT, which can be done both in the fasting state and after challenging with the glucose, that is what is recommended in those countries. But in countries like ours, there's a step down, because the belief is that we should not let the best come in the way of the good. And the recommended test, also evidence-based for countries like ours, is called a single step test. There's no screening and diagnosis. It's only a single step, non-fasting, 75 grams, and just one blood sample drawn 2 hours after ingestion of 75 grams. And if it's more than 140 mg%, she is labeled as a case of gestational diabetes mellitus or hyperglycemia in pregnancy. And then we take it further from there. So what is feasible in your institutional setup, depending on your context, that has been approved by our global body, completely in recognition with the fact that that's the best you can do. And incidentally, because of the corona COVID pandemic, because the access is so difficult, many of the affluent countries are also resetting and redefining what needs to be done for patients with hyperglycemia. So in keeping with this practicality and pragmatism, as how we call it, there's no ideal test, but a challenge with the glucose, and recognizing that her body cannot take this challenge and she develops hyperglycemia. That is the most crucial point. Yeah?
Thank you, Hema. Okay, thank you. So we are coming to the conclusion of this webinar. I hope that we convinced you that pregnancy is the window of opportunity. Next, please. Can I do it myself? No. Okay.
No, you can't, sorry.
All right. So I hope we convince you that, yes, pregnancy is the window of opportunity. Next. It's the center with specific endpoints for intervention for pre-pregnancy. We'll deal with it in another webinar. Next, pregnancy, mainly the first trimester. And today we dealt with post-pregnancy for mothers' health and the offspring's health. Next. The take-home message from our guidelines from Professor Eyal Scheiner: the following pregnancy complications should be acknowledged as predictors for long-term cardiovascular morbidity, hypertensive disorders, GDM, but also fetal growth restriction, preterm birth, and placental abruption. Next. Hema Divakar, as for hyperglycemia. Hyperglycemia in pregnancy has implications on the health of the woman and the future health of the offspring. If this goes undetected and untreated, the burden of diabetes would cripple the future generations. Next. Leona Poon for hypertension. Addressing hypertension in pregnancy is critical dimension in reducing maternal and perinatal risk, and risk-reducing measures must be implemented in order to prevent long-term non-communicable disease. And Fionnuala McAuliffe on nutrition and obesity: think nutrition, and wait first at every contact to give the gift of life free from non-communicable disease to our mothers and their infants. Next. And this is actually the main take-home message. It's all in the infographic. That's the production of the FIGO Pregnancy and the NCD Committee. We can translate it to every language, and it's all there. So please contact us. You have our contact links. You have our FIGO office in London. We'll be very glad to collaborate with you. It's translatable to every language over the globe. So that gives me a pleasure, next, to conclude this webinar in my name and in the name of the Pregnancy and NCD team. Thank you very much.